Moving on to sexually transmitted infections. So the ones I'm going to talk about today are chlamydia, gonorrhea, trichomonas. So chlamydia is by far and away the most common sexually transmitted infection. It can present with discharge. The discharge can be thick, yellow, green, sort of pussy idea. It can have a smell, or you may get absolutely no symptoms at all. So we do screen people if you are sexually active, and it's with a male. Very smart to use a condom, because that would be obviously much more protective. So the other thing is, with those no symptoms, you may want to consider screening if you are having unprotected sex, and that's an easy test. It can be tested in the urine, particularly if you don't have symptoms, or otherwise it's a vaginal swab. Chlamydia can also present with bleeding. So if you have any abnormal bleeding before your period, after your period, if your period is a bit early or a little bit late, or anything that's out of the ordinary for you, it would be super important to consider getting a check for chlamydia or gonorrhea, again, because chlamydia in particular can cause bleeding, or if you have bleeding after sex, that's a common one. Gonorrhea also can present with sort of thick, smelly discharge, or have no symptoms at all. So again, super important to get screened. It's a little less common in people who have vaginas than chlamydia is, but still around. Trichomonas is a sexually transmitted infection as well. That one has a copious amount of discharge in general. Green, tends to be frothy, has a significant odor. So most people who have trichomonas are aware of it, but not everyone. As with the other sexually transmitted infections, it can have no symptoms at all. Having said that, the reason we get more concerned about chlamydia or gonorrhea is because those two can actually travel into the tubes and cause an infection called pelvic inflammatory disease, and that can scar up the tubes and actually affect your chances of getting pregnant in the future, if that's something that you want. And it can make you quite ill, causing pelvic pain, increased discharge, sometimes a fever, etc. So chlamydia and gonorrhea can do that. So it's super important, if you have had unprotected sex or if you're having symptoms, to get it treated, because the sooner you treat it, the less likely you are to have it go up into the tubes and cause problems in the future. Trichomonas, on the other hand, can cause a lot of discharge and is very smelly and all of the things we discussed, but doesn't tend to go up into the tubes and cause pelvic inflammatory disease. So from that perspective, it's a little bit less concerning. Again, these are all treatable with antibiotics. The trick is picking them up. And of course, using condoms, it can help prevent those. So thank you so much for watching today. I hope you learned something about vaginal discharge and other common sexually transmitted infections. Again, super important to get your pap smear every 3 years once you're 25, and to consider sexually transmitted infection testing, from the onset of sexual activity. And if anything is new or different or concerning to you, obviously go see a healthcare professional and get yourself assessed.